Okay, so I actually want to show you a little bit more about what we call advanced dosing functionality within HEO. And so for that I want to go ahead and switch my patient to a 2-year-old. And this is Martha Jones. She's a 2-year-old on the peds floor. And so I've selected her inside the portal here, and then I'm going to enter orders again. So I'm going to take and look at her chart here in HEO. Down the left-hand side of the screen, you'll see she's allergic to penicillins, iodine, codeine, Bactrim, and then her current weight and creatinine clearance. Current weight's 9, creatinine clearance 20. And so I'm going to order some ampicillin here. And so if I select some ampicillin, number 4 here, it's actually asking me a couple things. So anytime you have a drug order that's involved that has weight or creatinine clearance or hepatic functioning or body surface area involved in its calculation, you'll see this window here. And so this actually provides the clinician an opportunity to change the dosing weight if they needed to. And this would probably be more relevant in a neonate or someone that you're using perhaps a dialysis patient where you want to change their dosing weight to be different than their actual weight. So I'm going to actually, the last current weight was 9 kilograms. We'll just leave that the same. We'll change their creatinine clearance. Let's say we want to, we'll just actually leave it the way it is. We'll just leave this and submit our, actually they want to say our dosing weight is required, and so what we'll do is we'll say don't change the current dosing weight, or actually use the actual weight for the new dosing weight, and then let's proceed. So we've now got a dosing weight of 9 kilos, an actual weight of 9 kilograms, creatinine clearance of 20, and now we're taking into this the ampicillin order. And so we've got the patient's weight, the dosing weight, and it's asking me for an indication. And so we're going to dose this for a non-meningitis. And then it's actually then giving me the warning that this is what happens if you have a drug allergy warning. It's reminding me this patient's allergic to penicillin and I'm getting ready to order ampicillin. Well, I still perhaps would want to order this. Let's say that they previously tolerated this drug without any problems. And that message actually gets sent over to the pharmacy so that the physician not only has acknowledged that they've seen that allergy, the pharmacist knows that they've seen it, and they know that a reason why they wanted to override that allergy alert. So that saved the pharmacist a phone call. That's also saved the physician a call back to the pharmacy waiting on hold. And so here's ampicillin. It's also giving us some reminders up at the top here. Infants and children greater than 30 days old, less than 14 years old, their dosing weight of less than 40 kilos. For non-meningitis, it's recommending that we give 50 milligrams per kilogram per dose every 6 hours. And so based on a particular set of parameters, and that is the dosing weight and the patient's age and the patient's weight, it's giving me a recommendation for a dose. And so that's the dose that it's showing me here. And so I'm going to take 50 milligrams per kilogram. I can hit enter, and then it's also then calculating that dose based upon their weight, their dosing weight. So it's multiplied that 50 times their 9 kilos, giving me 450. It actually did not round, but if it does round, there's rounding rules that can be applied here, and it'll tell you what that rounding was. But this was the actual dose of 450, and then I'll take this IV, and then the frequency was also calculated for me based upon all these parameters, and it recommended Q6 hours. You don't have to necessarily take Q6 hours, so just because that's presented to me, I still have options. If I want to see all my options, I can hit the question mark key, and I'll be given every frequency that's available for this particular drug. And I may want it Q8 hours instead of Q6, but if I wanted it Q6, I can just hit that, and then the next scheduled dose is when we want to start, no comments. And so that it's taken some ampicillin, 450 milligrams, which is 50 milligrams per kilogram per dose, IV Q6 hours. And so a neat thing about these advanced dosing recommendations, if you click on them, you can actually do a couple of other things. And so this is showing you a lot of extra functionality built in. You can actually look at the drug reference again, that monograph for this particular drug. You can also look at a patient education sheet if you needed to print out some sort of education for the patient or their family. You can also view the dosing region, and so that's exactly what we just did, was what's called a dosing region. And so it's telling me that based upon this patient's age of 2, their dosing weight of 9 kilos, their creatinine clearance of 20, and their patient location on the peds floor, that that they've taken those into consideration and given me these dosing recommendations based upon all these criteria. And so you can set up these dosing regions for any particular drug. You can set them up using their age, their post-conceptual age, their dosing weight, their hepatic impairment, their creatinine clearance, and their physical location in their hospital. All those can be taken into consideration when the system presents a particular dose and a particular frequency for a medication. And so you can see how this kind of functionality in the system can lead to the possibilities are really endless in providing information to the clinician at the point of order entry. And so it'll tell you then how the computer came up with the dosing region of this patient, and it'll let you look at exactly how it came up with that recommendation. There's also some neat things in medications that you can switch to other medicines. So a lot of times you can set up switch orders to a particular, this is an IV drug, you may want to switch them over to something oral. So a really common thing would be, having a switch order from IV Lasix to PO Lasix and vice versa, IV Levaquin to PO Levaquin and vice versa. And here's just some alternatives to ampicillin IV, and one would be obviously switch to ampicillin oral. And so if you click this, it would actually delete out the IV ampicillin and switch the patient over to oral ampicillin. So that's what's called a switch order. Okay, so I went ahead and switched back to Ed Smith here because I wanted an adult patient again to show you some more things. There's also a lot of shortcuts built into HEO, and one is if you already know what you want to order, the medication, for example. Let's say we want to order metoprolol 5 milligrams IV stat and once. We can actually type that into the search engine. The search engine is smart enough to know exactly what you wanted, and then up at the top is going to be metoprolol 5 milligrams IV and statin once, and that's what it ordered. So the search engine is very complicated. It knows exactly if you've typed in the dose and the route and the frequency, it'll go ahead and fill in those prompts for the clinician. So that's just another way to shortcut in how you would enter a medication orderable. There's also a lot of advanced functions with medications surrounding tapering doses, simultaneous dosing, exclusive ordering, that I'm going to show you here briefly. One is if you want to do a prednisone taper. So let's just look for some prednisone, and let's just start with, let's see here which one I want. Let's take some oral prednisone. So I want to do, we'll start with a 40 daily next scheduled dose, and we'll say for 3 days. Okay, so that was my oral prednisone, 40 milligrams orally times 3 days. And so let's say I wanted to build a taper now. So I can click on prednisone. I want to say I want to build a tapering dose. And so the next thing I want to do is after they finish those 40 milligrams for 3 days, I want to take them down to 30 milligrams daily for 3 days. And then it's asking me if I want to enter another taper order, and I'll say yes. So now I'm going to take them down. Let's see, I did 40, 30. Let's do 20 milligrams daily for 3 days. And then I'll put in one more taper here. I'll put them down to 10 milligrams daily for 3 more days. And I do not want to enter another taper. And so what happens here on the left here is you've linked all of these particular medication orders here. We've got prednisone 40 a day, 30 a day, 20, 10, each of those lasting 3 days. And there's a little symbol here indicating that those are a tapering dose. So another example of some advanced medication dosing would involve what's called a simultaneous order. And that would be if you wanted to order some, say, some pain medicine like Dilaudid, and we'll do some Dilaudid, 2 milligrams every 6 hours. And then we wanted to simultaneously give them an antiemetic like Phenergan. We can click on the Dilaudid on the left here. We can say build simultaneous order, and then we'll go look for some Phenergan. So we've got some Phenergan, and we will do 6.25 IV, and it's already defaulted here for Q6 hours. Entered. We don't want to build another simultaneous order. So over on the left here, you've got a plus sign linking these two orders together, meaning that they'll be given simultaneously. Also can do what's called exclusive ordering, meaning that if you wanted to make sure that the patient only got a limited dosing of Tylenol in a day, and you needed to order, some oral as well as some rectal Tylenol, you could do that as well. So we'll do some just regular Tylenol here. Let's see, we'll do some oral Tylenol, 500 milligrams, Q6 hours for fever. So we've got that Tylenol order now, and we're going to click on this, and we'll build what's called an exclusive order. And so we'll also say we can, if they're say they're having some emesis, we can give them some Tylenol suppositories instead. But we don't want to give the suppository if we've given them the oral already, and vice versa. And so we'll do a suppository here, 650 Q6 hours. And so that then puts together these two orders, Tylenol 500 Q6 for 3 days for fever, or Tylenol suppository 650 Q6 hours PR. And so that is what's called an exclusive order, meaning that you either give one or the other but not both.